テレビ東京論文支局のトム・シーザーです。From inside the Financial Times headquarters in the heart of the city of London, this is Inside FT, brought to you by TV Tokyo. Here's today's headline. Trump tariffs on EU medical devices will drive up US patient bills, industry claims. The Trump tariff war continues, and as countries and industries around the world grapple with the volatility of this new trade order, one sector in particular is sounding the alarm: European healthtech manufacturers. Trump has placed a 15% tariff on EU medical devices in an effort to bring more healthcare production back to the US. But will this move actually shift manufacturing, or will it simply drive up American medical bills and destabilize global supply chains? We sat down with Peter Foster, the FT's World Trade Editor, to explore the real effects of these tariffs on Europe's healthtech sector, the complexity of the global medical supply chain, and what this all means for the future of healthcare manufacturing.
The big concern for EU medical device makers of a 15% tariff is that it's going to hit their bottom lines. Both Philips and Siemens Healthineers, two big medical device makers in the EU, estimated the impact in an earnings call at 250 million euros in this fiscal year. The CFO of Siemens Healthineers told me that the impact would grow to 450, maybe 500 million euros in the second year. And there's a reason for this. You might think that it's US importers that are effectively paying these tariffs, which they are. But these companies operate on long-term, fixed-term contracts, often which run for 1 or 2 years. And therefore, they're already hooked in to a price structure. So in that scenario, the EU company is effectively having to eat the tariff. Longer term, the EU companies are telling us that actually, in the end, they will have to recoup those losses, and they'll do that by a mixture of changing their supply chains, trying to make things cheaper, but also, in the end, quite likely, putting up prices for US consumers. It's going to raise prices for American consumers, American insurance companies and patients, and it's going to make the highly complex supply chains that link European medical devices and European medical device supply chains, it's going to make those supply chains more fragile. And when those supply chains become more fragile, we have big events like pandemics, like other shocks to the system that are less resilient, less able to cope. And that could lead to supply deficits, lack of materials down the track.